Hello dear student friends. Today we are going to discuss the topic concept of compliance and predicting whether patients are compliant, followed by the work of Ley on predicting the level of compliance. Understanding the concept of compliance is important. First, in the context of health psychology, the term compliance refers to the degree to which patients carry out the behaviors and treatments their practitioners recommend. Hence defined compliance as the extent to which the patient's behavior in terms of taking medication, following diets or other life changes coincides with the medical or the health advice. If we focus on this definition deeply, this definition expands the concept of compliance beyond merely taking medications to include maintaining health, lifestyles, practices such as eating properly, getting sufficient exercise, avoiding undue stress, avoiding smoking, and not abusing alcohol. Also, the concept of compliance includes making and keeping periodical and dental appointments, using helmets and seat belts while traveling in car, and engaging in other behaviors that coincide with the best health advice available. And sometimes in some health psychology books, instead of compliance, you may find the term adherence. So don't get confused, because majority of health psychologists and professionals felt the term adherence would be more appropriate than the term compliance. So if you follow the links or any books provided in the material, and if you find the term adherence, don't get confused. It's nothing but the term compliance. But the compliance would not be same in all the patients. Some patients may just follow exactly what their doctor says, and they may not follow it exactly, but they may try to follow what he says to some extent. But some patients would be so reluctant that they just may go to the doctor, but they will not follow any of the prescriptions or medications or whatever suggestions given by the doctor. So we have to consider the compliance as a continuum. In the sense, the chances are there that there would be variations in the compliance from person to person, and even in the similar person, the concept of compliance may vary from situation to situation. So, compliance can be viewed as a continuum. Patients may comply fully, patients or not at all comply with the doctor's prescription. So if you consider as a continuum, one end it's like non-compliance, patients don't follow the advice of doctor at all, and the other end would be complete compliance. So viewing it as a compliance, let's discuss the variations in the levels of compliance. So the first one, if we go to the one extreme of the continuum, it's non-compliance or non-adherence. Can be direct, in the sense the patient refuses to take appointment and meet the doctor. He may postpone it. He may say, okay, I'll do it later. I'll take appointment the next day, maybe the next week, maybe the next month, but that will never come. Or else, sometimes the non-compliance would be indirect, that patient takes appointment but he has no intention to meet the doctor. And if you travel from the continuum from that end and just progress a bit further, it will be partial compliance, which refer to incomplete medication taking due to variety of reasons. Patient may have difficulty getting into the habit of taking medication. They may say, I forgot, I'm not used to taking this medicine. They might take medical holidays on weekends or on vacations. I'm busy, I haven't carried my medical kit with me. Other particular compliant patients take lower dose of medicine, for what? For saving their money. And then if you progress ahead, comes premature discontinuation, the next stage on the continuum of compliance. Results in taking suboptimal dose of medication. This can be result of refusing to refill medication after achieving a certain medication effect. The reasons for premature discontinuation may be because patients forgets to continue the medications in the absence of symptoms. Now here where the majority of patients will get hold. Most of them, once they overcome their symptoms and they are feeling fine and they are nowhere not able to sense any negative health symptoms, what happens is they stop taking it. They feel, okay, now I am fine, why should I continue? Let's see if it comes again, otherwise it's better I don't take. So here where majority of people get caught hold and they don't comply fully with the doctor's prescriptions or suggestions. Sometimes patients experience uncomfortable side effects and discontinue taking their medication. If you see some psychotic drugs, there will be lots of side effects. Then maybe patient may not comply completely with the doctor's prescription, or sometimes whatever the symptoms they are feeling at the time of medication, they just attribute it to the reason of taking medication and they may stop taking their medication. Lastly, some patients may discontinue their treatment because they remain unconvinced that the benefits of taking it outweigh any perceived inconveniences associated with consuming it. In the sense, they don't get convinced. They feel, even though if I follow this, the chances of overcoming this health issues would be 50-50. So better I don't follow it. And now coming to the extreme end is patients who are completely in compliance with the doctor's prescription or the doctor's suggestions. These patients follow what doctor says exactly. They take appointments on a regular basis and meet the doctor, and they make sure until unless doctor says to stop the medication and they are completely fit, they try to follow match to what doctor says. But how we can actually say that a patient is compliant, or to what extent he is compliant? For that, we need to identify certain variables or certain factors which help us to predict whether patients are compliant or not. So broadly, there are some predictors we can categorize as illness characteristics. The characteristics of illness a patient experience would be one of the predictor, and the next predictor would be personal characteristics. What kind of personality the patient have, that also influence in the sense his personality traits, his beliefs, his perceptions, his attitudes. And next comes the cultural norms. We can't deny this is also one of the important predictor which helps us in analyzing the compliance levels of the patients. Sometimes the culture influences a lot. Let's see how it is when we discuss about it in detail. And next comes, which is very important for our compliance, is practitioner-patient interaction. So it's the communication process also influences a lot in predicting the compliance. So let's start focusing in detail about the first predictor, that is illness characteristics. Illness characteristics, in the sense, the first one is severity of illness. People or with a serious illnesses are more likely than people with a mild illness to seek medical treatment or comply with the medical advice. If the symptoms are very severe, because of the desire to overcome these inconvenience or aversion feelings, obviously the chances of compliance would be higher from the patient end. And side effects of the illness. A second factor is the side effects. If the unpleasantness, the side effects and the symptoms patients experience more while taking a medication, then it would negatively related to the compliance. In the sense, the patients will become very non-compliant. They prefer not to follow it, or they try to reduce the dosage by themselves without consulting the doctor. So the more the side effects, the more the non-compliance. And next one is duration of time. If the duration of therapy increases and the days for taking medication increases for months and then to years, obviously people tend to become more non-compliant. So the duration does also matters. And next, the complexity of treatment. Study says more the complexity of the treatment, the lower the rate of compliance. If it is too complex, it's above the understanding and they are not sure where it is going, obviously the compliance would be low. And next come to the second broad category which predicts the compliance is personal characteristics. Personal characteristics of a patient does also matter a lot. Let's focus on it. The first one is the age. So, if we see, the studies are saying adolescents are less compliant with the doctor's prescription. Some studies done on the diabetic patients of adolescents, they are actually not following the medication so continuously, and as a whole, study says that as the aging process takes, the more people start concerned with their health and the compliance rate would increase. In the sense, older people are more compliant towards the doctor's suggestions than the youngsters. And next one comes the gender. Does the gender influence the compliance? Overall, the study says the variance in the compliance is almost similar in both the genders, but some studies says that women are more particular, showing more amount of compliance for following diets and taking medications for mental disorders. And next one, which is very crucial, is social support. Social support is a strong predictor of compliance. Strong prediction of compliance is the level of social support one receives from friends and the family. In the sense, people who are isolated or tend to be non-compliant because people around make them, ensures them they are following their diet, ensures them they are taking medication on regular basis. And next comes, which is actually related with social support, the next variable is emotional support. Here, the important is not the quantity. The important here is the quality of the interpersonal relations we are having towards our family and friends. And this is a very strong predictor. Caring and loving people around at the time of illness will leads to higher compliance amongst the patients. And next comes personality traits. Many studies have been done on the personality traits and two findings have been highlighted. Study says people with obsessive compulsiveness generally more compliant. In the sense, people are obsessed of following exactly what it is. So they are more compliant. And studies also says people who are cynically hostile are less compliant. It's very difficult to influence that kind of patients. And next comes personal beliefs. What kind of perceptions the patients holds also influence the compliance. When patients believe that if I follow the treatment and the recommendations of what doctor says results me in health benefits, then they are more likely to comply with those recommendations. On the other hand, there is a concept called locus of control. If patients who have a basic personal tendency of external locus of control, who more believe on external factors, they may think that it's nothing in my hands. Even though if I take medicine, to what extent I can control? Maybe it's more on, it depends on my destiny, my fate. I got nothing to do with, or God is there to take care of me, then they are going to comply less with what doctor says than the people who are high on internal locus of control, who ascribe themselves as a responsibility to the health situation where they are today. in the sense people who are with internal locus of control believe that yes, it's in my hands. If I regularly follow what doctor says and if I change my lifestyle, definitely it's health crisis, but definitely I can overcome this. So many studies have been done on cancer patients, and studies are saying that people who have internal locus of control could overcome this crisis situation very easily and comfortably than people with external locus of control. And next comes cultural norm. For example, to make you understand this more clearly, let me give you an example. If one's family is with kind of tribal tradition which includes strong belief in the efficacy of the tribal healers, they may have some tribal healers whom they usually approach. It seems to be reasonable that the individual's compliance with modern medical recommendations might be low, obviously, because they believe that if I follow that I can overcome. But this English medication, I'm not sure, maybe there will be lots of side effects. So that also influence the compliance of a patient. And next, the third general broad category is the practitioner-patient interaction. So under this, there are two important factors which we have to focus. The first one is verbal communication. Verbal communication in the sense, if there is any disturbance in the whole communication process while interaction is happening between the doctor and the patient, then obviously that may influence your compliance. For example, when doctor fail to listen what patient is trying to say, that may influence. Sometimes the language may be a barrier. Patient may belong to the mother tongue of patient may be different, and the kind of language doctor is trying to communicate with the patient would be different, and if it's really tough for the patient to understand, there the problem may come. And another thing is, some of the patients, if they don't have enough knowledge or if they don't have any exposure to the medical field, they may have problem in understanding the medical jargon or the medical terminologies used by the doctors. Then the problem may come. Doctor may ask something and the patient may say something else. So if any disturbance takes place in the whole communication process, that will influence the compliance. Sometimes the patient is not listening exactly what doctor is saying, in the sense he is present there physically, but he may be thinking something else, or maybe he is feeling extremely anxious, stressful, and what doctor is saying is not going into his mind. That will also influence the verbal communication. And next one comes, which is very important, is practitioner's personal characteristics. If the studies are saying that if the practitioner is warm, caring, friendly and interested in the welfare of the patients, then that will actually motivate the patients to follow what doctor is saying exactly, in the sense that results in high level of compliance. Also, we can't deny the fact that compliance would be higher when the patient believe or the patient realize that the competence and the knowledge of the practitioners is more, then they strongly believe what doctor says and they prefer following it exactly. Now, taking these things into the consideration, the predicting variables, Philip Ley developed one model. Though there are several theoretical models attempted to predict and explain compliant and non-compliant behavior, one of them is cognitive hypothesis model of compliance, which offered by Philip Ley. Philip Ley combined or focused on three variables which he believes are the strong predictors of compliance. This theory have been very influential because he focused on the cognitions. Cognitions in the sense what they think, feel, perceive and attribute. So he focused on three variables or three factors. First one is patient satisfaction in the process of consultation. The second one, once they feel satisfied, they have to understand the information given by the doctor, and then comes patient should be able to recall the information offered by the doctor. Ley strongly feels that these three factors are the better predictors for compliance, and many studies actually have been done by other researchers too on these three variables. So let's start discussing about the first factor, that is patient satisfaction. So in the Ley studies, he found that the levels of patient satisfaction stems from various components of the consultation, especially the affective aspects. It indicates the emotional support and the understanding. If the doctor is supporting the patient emotionally and he is empathetic, that would influence the compliance. And next factor is the behavioral aspect. How the doctor is prescribing the medication. Is he able to give the adequate explanation? We try to attribute the doctor seeing even his behavior, and that also influence our compliance. If a doctor is harsh towards you and he is rude while talking to you, even that behavior affects your compliance or the patient's compliance levels. And the third component is the competence of the doctor. If we believe that the doctor is competent, skilled enough, then we tend to follow his prescription more. And Ley also reported that satisfaction is determined by the content of the consultation, and the patients also want to know information as much as possible. To make you understand this better, let me give you one example. Some studies looking at the cancer diagnosis, patients showed improved satisfaction if they were given a diagnosis of cancer rather than if they were protected from this information. In the sense, even though giving a patient a news that he is with cancer, he prefers taking the information exactly rather than manipulating the information. And then studies also revealed that information which is more personal to the patient results in greater satisfaction when it is compared to impersonal information. Also, some of the researchers explore the relation between the humor and the compliance, and it says that doctors who use light humor while interacting with the patient, that leads to high amount of compliance. And now comes the second predictor of compliance offered by Philip Ley is patient's understanding. Once he got satisfied with what doctor is saying, now it's a time for him to understand exactly what is the sickness, what are the reasons for this, and where that organ where I'm suffering is located. So all these things are also plays a key role. So compliance is strongly related to patients being able to understand not only the nature of their condition but also importance of advised treatment and the process involved in the treatment. Patient definition of different illnesses. For example, if a patient is suffering from high BP or hypertension, he should know what is high BP. He should be able to define it. He should be able to conceptualize it. And he also should have a knowledge of the location of the organs that is contributing pain or some severe negative indications. And for patients to comply with the doctor's treatment, the patient's understanding of the causes of their illness is also crucial. For example, he should know, like if he have problem with his heart, he should know, is it because of his lifestyle or is it because of the genetical reason? What is the reason for this? The complete understanding indicates knowing the reasons, understanding why doctor is saying to follow these guidelines and what is actually contributing to this. And the third thing which is very important, though they understand, though they are satisfied, is the patient's recall, that he should be able to recall what doctor said exactly. Researchers also highlight the importance of patient's recall in the process of compliance. Patients may report good satisfaction with their consultation and good understanding of the condition, but if they cannot remember the advice, then it just goes waste. So Ley's found that the following psychological factors, some of the following factors which I am going to tell now, influence a lot the information or in the recall of the information in compliance. So let me tell you one after the other. The first one is lower anxiety. The patient may recall the information when the anxiety levels are low. If it is his anxiety is high, he may get blank out. He may not recollect exactly what he is saying. And then medical knowledge. Minimum medical knowledge is required for the patient to recall it easily. And then comes higher intellectual levels. Patients who are highly intellectual, it's easy for them to recall, and also they usually have higher compliance towards the doctor information. And next comes the importance of the statements. If they understand the importance of the statements, or usually they recall the information more which is important to them. And then comes the primacy effect. Here the primacy effect indicates where we remember most of the first things that is said to us. And Ley also pointed out that the age has got nothing to do for the patients to recollect the information. Usually there is a stereotype, like as people get older and the aging process takes place, for them to recollect the information is difficult. So let's have a brief summary of what we discussed till now. We discussed about the concept of compliance. Compliance indicates following the advice or the suggestions offered by the doctor accordingly. So this compliance can vary from patient to patient. We can consider this concept of compliance as a continuum. One end may be non-compliant. Patient may non-compliant in the sense he may not follow the guidelines offered by doctor, and the other end would be compliant where they follow completely. In between, we can say patient may be partially compliant where they follow a guidelines and prescription to some extent and then they may stop. And then we discussed about the predictors to analyze the compliance. So under the predictors, we discussed about the illness characteristics. The characteristics of illness does influence the compliance, and the personal characteristics, followed by culture norms, and finally the practitioner patient's interaction. And then finally we discussed about the model offered by Philip Ley. It's a cognitive hypothesis model to explain the predictors of compliance. In this model, Ley focused on three factors: the patient satisfaction, patient understanding, and the ability of the patient to recall the compliance information. So I hope this session have been useful for you to understand the concept of compliance. Thank you.